Hello, my friends. Today I want to talk about the role of light sensitivity when we look at neurological dysfunction. My name is Dr. Nathan Kaiser at the Kaiser Clinic in Chelsea, Michigan, and we help people with neurological problems help to be able to understand the underlying and be able to work towards solving them. So today I want to just show one example with the caveat that when you think about light sensitivity, there isn't only one way in. But I want to show you a little bit about how we come to understand light sensitivity in this one case that I think is useful, one, to a lot of people, especially those that have had some sort of brain injury. And that brain injury could be traumatic, like a concussion, fall off a horse, playing basketball, whatever it is. But it could also be trauma that's relative to chemistry or infection. We want to start to think about those in a similar way because both of them are traumatic to the brain. Let's talk first about pupils. When we think about light sensitivity, we know that there's an amount of signal that's going through the pupil, right? Light signal that's going in, and our brain is processing that light signal at a speed that should keep up with the level of light. Now, we have a normal inborn sort of dimmer switch, or the ability to control the light that is the pupil. So when it gets really dark, our pupils get bigger, they let in more light. When it gets really bright out and we're in the midday sun, those pupils should constrict down and hold, and that decreases the amount of light. Those things help us to be able to see more clearly and to be able to have depth changes, things like that. It's a really useful tool. We take it for granted all the time, but it's very, very, very important. Now, that pupillary system overlaps, or it lives next door to other components of the brain. So the main pupillary control centers live in the midbrain, and they're kind of governed by areas in the frontal lobe and the prefrontal cortex. And you can think about that as like the machine that drives your executive function, your personality, that all coalesces in there to create an output. And part of that output is controlling that level of pupillary activity. That's why after concussion, or if we have severe brain injuries, you'll see, like in the movies, people shining the flashlight in the pupil to see if it's reactive, because it's a window into what's going on in those reflexes within the brain. The reason that that is important is because we want to look at the functionality of that midbrain as a precursor to everything. So as information flows through that area, are you able to process it effectively and then convert that into the appropriate motor output? And if we can't, then we may see a breakdown in that system, which may induce that light sensitivity. So for example, if that control system for the pupil isn't active, and I'm, rather than being able to constrict the pupil when there is brighter light, instead it fatigues and that pupil gets larger, it's going to let in more light than it typically would. And if it lets in more light than it typically would, there's a higher probability that it's going to be a noxious level of light, right? Like too much light. And sometimes that too much light is what we feel as the photosensitivity. Letting too much light in to start with starts the whole program wrong. Now, there are other instances where when that light comes in, the neurons that sense it are just too sensitive to start with, and then we feel sensitive to a normal amount of light. So there's two different causes. In this way, we're going to talk about the one where we just don't control the light response well enough. We've talked about that pupillary response has its reflex arc through the midbrain. Then we can think about, well, what other things also have reflex arcs or movement arcs that come through the midbrain. And one of the ones that we can look at that has some shared nuclei in the superior colliculus is vertical saccades, or the transfer of a vertical saccade. But what that means is when I look up, that's a saccade. So when I move my eyes around, those are saccades. And then when I look up and I hold it, I have to transfer that saccade into a gaze holding. So it kind of combine them when in areas in the midbrain. They integrate in the midbrain. So we look at this functionality where if I'm moving my eyes up and down, or I'm holding my eyes up and down, we have a shared structure that is also controlling the pupillary response. And in a healthy person, we should be able to look up and not have our pupils change unless we're looking into a different light. So we do a test where we put people in the dark. They're in VR glasses, so there is no change in light. We have them look straight ahead, and then we have them look up. And the idea being we should be able to hold our eyes steady, number one. If we can't do that, then we know there's a problem in the computer hardware that runs that in the midbrain. Okay, number two, we should be able to look up and also not have their pupils change. So what I'm going to show you is this video where we're going to look at a patient where their eyes go up, and you're going to see their pupils going to pulse like this. And what you're looking at is basically fatiguing of that system being able to hold that pupilloconstriction. So it's kind of like if you ever do a workout and you're trying to hold You're just trying to hold a weight up. And if you're holding that weight up and you start fatigue, it's going to kind of drift down, and then you pull it back up. So you're going to see it's going to be like a wave. So you're going to see this person look up right here, and you see that pulse of the pupil. It's getting bigger, smaller. But what we learn from that is something as simple as just looking up, where we have this shared locality of where these neurons work. Just by looking up causes instability in that system, so the pupil isn't able to hold its constriction. And if it's not able to hold its constriction, you can imagine if someone's reading, if someone's doing something where they're scrolling, where they're looking far, they're looking at the board. Let's say you're in a classroom where you're looking at your computer at work, or you're just driving and there's light coming in, through the windshield. If you're using that nucleus where you're trying to hold your eyes in different places, but the pupils aren't able to hold, and we're getting these pulsations where we're letting too much light in at moments, then you can see how that's going to yield a level of too much light going into the eye, which is going to cause the probability of having that photosensitivity. So in this case, what we're doing is working on, can we strengthen that pathway in the midbrain? We get that whole thing to loop a little bit better so it's stronger. We can do more things with our eyes, right? Be able to use the full construct of what we're capable of, and then not have that pupil fail. I hope that's useful. So especially if you're someone that's had light sensitivity from a concussion, light sensitivity after an infection, I think that's a useful thing to look at and a way to understand it in a way that feels less mysterious, but hopefully can give you a direction to start to pursue towards solving those symptoms you're having. So remember, we're going for the mechanism underneath. If we can get that mechanism to work better, can we get the symptom level to reduce? That's the goal. That's what we want to work on. So please leave a comment. Let us know what you think, or reach out to us, send us an email. If we can help you, we'd love to try. Take care.